Hello everyone, I'm Dr. Lim Shaolei, and today we are going to talk about hereditary endometrial cancer. Endometrial cancer is the fourth most common cancer affecting women in Singapore. Its incidence is rising. Cancers are caused by damages to the genes in our body. These gene damages are also known as gene mutations. Genes are the instruction manual in our body that make sure that our body works properly. Some genes also protect us from cancer. When mutation occurs in these cancer protective genes, cancer develops. Gene mutations can be caused by aging. The incidence of endometrial cancer rises with age. It is more common in women above the age of 50. Gene mutations can also be caused by environmental and lifestyle factors. Obesity is a major risk factor for endometrial cancer. We can also inherit a mutated or faulty gene from our parents, which puts us at increased risk of certain types of cancers, and we call this hereditary cancer. 3 out of 100 endometrial cancers are hereditary in nature due to Lynch syndrome. Lynch syndrome is one of the most common hereditary cancer syndrome. It is estimated that 1 in 300 people have Lynch syndrome, though the majority of them may not be aware of it. It is due to the mutation in one of these 5 Lynch syndrome genes, the MLH1, the MSH2, MSH6, PMS2, and the EpCAM gene. When the cells in our body divide, the DNA, which is our genetic code, needs to be copied over. Mistakes are very common during this gene copying process, resulting in the formation of mismatched DNAs. The role of the Lynch syndrome genes is to repair mismatched DNAs. They act like spell checkers to correct the typos. In Lynch syndrome, these Lynch syndrome genes are mutated. Therefore, they will not be able to do their job properly. This results in the accumulation of large quantity of mismatched DNAs which are faulty. Over time, this can lead to the development of cancers. The 2 most common cancers associated with Lynch syndrome are endometrial cancer and colon cancer. Lynch syndrome also increases the risk of other cancers such as ovary cancer, cancers of the gastrointestinal tract, and cancers of the urinary tract. The mutated gene is inherited either from the mother or the father. There is a 1 in 2 chance of passing on the gene mutation to the children. We suspect Lynch syndrome when there are multiple Lynch syndrome associated cancers in the family, especially if these cancers occur at a young age. By that, we mean before the age of 50. However, family history alone is unreliable. Increasingly, oncologists are screening for Lynch syndrome in women diagnosed with endometrial cancer. We can use the cancer tissues that are removed from the patient during the surgery to check for mutation in the Lynch syndrome genes. However, to confirm the diagnosis of Lynch syndrome, we need genetic testing. This involves blood tests to check for gene mutations. But before embarking on genetic testing, we recommend that you speak with an oncologist or genetic counselor, as they will be able to assess your risk and advise if genetic testing is right for you. Though Lynch syndrome only accounts for 3% of all endometrial cancer cases, it is still very important for us to know. A person with Lynch syndrome and their relatives are at increased risk of certain cancers. These cancers may be prevented or detected early through enhanced screening, such as colonoscopy screening for colon cancer, ultrasound scanning for endometrial cancer. Medications like aspirin may also help to reduce the risk of colon cancer. Some Lynch syndrome carriers may even opt for preventive surgeries to reduce their cancer risk. These risk-reducing strategies help to save lives and are specially customized for an individual, taking into consideration the person's cancer risk, outlook, life stage, family and reproductive plans. Importantly, knowing whether a person has Lynch syndrome may also affect the way we treat their endometrial cancer. The Lynch syndrome gene mutation that makes a person more susceptible to endometrial cancer is also a weakness that drugs like immunotherapy can target. Immunotherapy is a new way of treating cancer. It is a drug therapy that enhances or boosts our own immune system to fight cancer. Studies have shown that Lynch syndrome-associated endometrial cancer respond very well to immunotherapy. This is because these cancers possess many mutations, as we discussed earlier, making them look very distinct and very different from the normal cells in our body. This triggers our immune system to recognize these highly mutated cancers as foreign invaders and destroy them. Immunotherapies are short infusional treatments that can be given in the outpatient clinic. The responses of Lynch syndrome-associated endometrial cancer to immunotherapy can be quite dramatic and can lead to prolonged patient survival. It has revolutionized the way we treat advanced endometrial cancer. Finding out that you are a carrier of hereditary cancer can be overwhelming. But when it comes to cancer, knowledge is power. Whilst we cannot change the gene mutation that we inherit from our parents, we can take positive steps to minimize our cancer risk and make better treatment choices when it comes to treating cancers associated with Lynch syndrome. I hope this video has been helpful and thank you for watching.